Can we reverse aging? Chronologic age is the number of years you arrive at by starting with the day you were born and counting forward. On the other hand, biologic or physiological age is the state of wellness or illness as a total reflection of each of us as functioning organisms. Aging is a continuous process, but the rate at which we age is variable. In almost every successive generation of humans, average lifespan has surpassed that of the generation before it. There is no scientific evidence to show that in some old ages, longevity was much greater than what we have seen over recorded history. We also have no evidence that a magical environment exists where people live extraordinarily long lives, although there are some areas where longevity is remarkable, such as Okinawa in Japan, Abkhazia in the former Soviet Union, and Loma Linda, California. These environments have no commonalities of geography or ethnicity, but they are all clean and non-toxic, and the people there share several lifestyle factors that contribute to longevity. They all tend to have a low body mass index, BMI, they eat healthy diets rich in vegetables and fruits, they have low meat intake, they use very few chemicals except salt to preserve their food, they engage in consistent, lifelong, strenuous physical activity, and most prominently they have strong social ties. The good news is that every region of the world has places that can support healthy and productive people over the age of 100 years old. These super longevity zones are getting more and more publicity, but we should remember that the people there have adopted lifestyle changes over generations that suit them very well, and there is nothing magical in those places. In fact, we can boost our longevity potentials by making the same adaptations to our lifestyles. The illusion of fountain of youth is the most prevalent of all the immortality myths. Its adherents look for miracle drugs, foods, or restorative substances that will prevent aging. You may have heard, for example, about human growth hormone, HGH. HGH is secreted from the anterior pituitary lobe to stimulate cell growth and reproduction. The positive effects of naturally occurring HGH in the body include reduction of body fat, increase in muscle mass and bone density, enhancement of skin tone and texture, and increase in energy level. The normal effects of naturally secreted HGH have led to a search for other ways to use HGH to improve human performance. In a study reported by the New England Journal of Medicine, a small group of men over age 60 who were treated with HGH experienced significant increases in lean body mass, meaning growth of muscles, and bone density. A later study at Stanford University concluded that HGH allowed the body to accumulate more water in the muscles but did not promote muscle growth or strength. Researchers also found that using HGH regularly brought on negative side effects, including an increase in type 2 diabetes. Furthermore, virtually all cancers require large amounts of insulin-like growth hormone, which is similar to HGH. This means that using HGH could stimulate cancer growth. Anabolic steroids are hormones whose function is to increase protein synthesis in cells, causing cellular tissue to build up. Without question, anabolic steroids make users bigger and stronger, but long-term use or excessive doses can result in serious health risks, such as an increase in low-density lipoprotein, LDL, bad cholesterol, and a decrease in high-density lipoprotein, HDL, good cholesterol. These steroids also raise blood pressure, cause liver damage, increase the risk of prostate cancer in men, and disrupt the menstrual cycle in women. Another widely misused drug, dihydroepiandrosterone, DHEA, is also a naturally occurring hormone in the body, manufactured in the adrenal glands. It is a precursor for the sex steroids, both androgens and estrogens, so both men and women have it. DHEA been touted as a way to stop or reverse numerous age-related diseases, but again, studies have found no benefit for elderly patients. Cell therapy involves ingestion or injection of cells taken from embryonic animals, with the idea that these cells have ingredients derived from the pluripotent stem cell that could confer youth and anti-aging properties. However, such cells do not migrate to targeted areas in the body and contain foreign animal proteins that can be dangerous to humans. Finally, many herbs and medicines have been promoted for anti-aging uses because they are natural, but there is nothing in the definition of natural that means things are safe or beneficial for human health. In fact, many natural substances that are beneficial to humans can also be toxic or fatal if taken incorrectly. Some of the biggest problems with natural remedies have to do with bioavailability, which means the dose of the active ingredients in these remedies and how they are delivered into the body. Ultimately, when we get to the bottom of the list of approaches that we might pursue to help us live forever, there just is not anything out there. We need to look to time-tested methods of ameliorating the ailments that come with advancing age without resorting to miracle cures that do not exist in reality. Copyright Academy House, www.academy.house